Healthcare is under pressure from every direction. Doctors are overloaded. Hospitals are stretched thin. Patient care is getting more complex. And at the same time, we're generating more medical data than any human being could ever realistically process. Scans, labs, notes, genetics, wearable data, lifestyle data. That's where AI enters the conversation. Not as a magic fix, not as a replacement for doctors, but as a tool. One that can see patterns faster, catch things earlier, and help clinicians make better decisions when time really matters. And the upside here is enormous. Earlier cancer detection, faster stroke diagnosis, personalized mental health care, quicker drug discovery, fewer misdiagnoses, more time for doctors to actually talk to patients instead of staring at screens. But let's be honest, there are real risks too. The real question is how it gets used, who it serves, and whether it actually makes care more human instead of less. AI works best in healthcare when it stays in its lane, augmenting human judgment, not replacing it. When it's transparent, when it's equitable, when it's designed to serve people, not systems. At the heart of these new healthcare tools are something called large language models. These are deep neural networks that learn patterns in human language by processing enormous amounts of data. They don't think or understand like we do, but they predict what words, concepts, or connections should come next based on what they've seen. They are trained by being exposed to billions amounts of data, books, articles, clinical notes, even health records, so they can recognize medical concepts and patterns. Training these models happens in stages, like building a pyramid. First, models are pre-trained on very large collections of text, learning the structure of language itself, then understanding medical concepts. After that, researchers fine-tune them on domain-specific data like clinical notes, radiology reports, research literature, or patient histories, so they actually understand medical context and can generate relevant, accurate outputs. Then, training uses techniques like reinforcement learning from human feedback to align the AI with how real clinicians think and respond. After all this data is processed, the response rate is lightning fast, and the error rate is incredibly low compared to human doctors. It doesn't suffer from cognitive decline, knowledge gaps, fatigue, memory loss, or burnout. All of this training lets AI do things like suggest diagnoses, interpret scans, summarize complex records, or flag early warning signs that even experienced doctors might miss. But it also comes with challenges like bias, privacy concerns, and the need for equitable access. And with that foundation in place, let's look at how this technology can show up in real patient lives, cases where AI doesn't replace care, but truly enhances it. Mark is 52. He feels fine, works full-time, walks his dog every day. No chest pain, no dramatic symptoms. But Mark wears a smartwatch connected to an AI-driven cardiovascular monitoring system. Over months, not days, it notices subtle changes: heart rate variability drifting, sleep quality dropping, and tiny irregularities most doctors would never see in a single visit. The AI compares his numbers in real time to millions of people who have had heart attacks. It notices a risk pattern and alerts him and his care team. That leads to a preventative cardiology visit, imaging, and lab work. Turns out Mark has early-stage coronary artery disease caught years before it would have caused a heart attack. No emergency, no ICU, just lifestyle changes, medication, and monitoring. AI didn't prolong Mark's life in one dramatic moment. It saved him by paying attention quietly, patiently, and often. Darlene is 38. She finds a small lump during a routine self-exam. The initial scan looks probably benign, but the imaging is also reviewed by an AI system trained on millions of cancer images, far more than any human radiologist could ever see in a lifetime. The AI flags something subtle, a pattern linked to an aggressive but highly treatable early cancer. Doctors double-check. A biopsy confirms it. Because it's caught early, Darlene avoids chemotherapy. She avoids major surgery. Her treatment is targeted, faster, and far less traumatic. This is AI acting like a second set of eyes that never get tired and looks for patterns over millions of cases. Jordan is a college student dealing with anxiety and depression. On the surface, things seem manageable. But behind the scenes, his phone-based mental health AI app notices changes. Language patterns, sleep disruptions, reduced movement, increased isolation, nothing dramatic. But to AI, trends matter. The AI system flags elevated suicide risk and prompts a check-in. An AI chat tool, trained in cognitive behavioral therapy, reaches out and asks him about his day and how he's feeling. Shortly after, a therapist checks in. Jordan admits he was close to spiraling but didn't know how to ask for help. Care is adjusted. Support increased. A crisis is avoided not because someone hit rock bottom, but because AI noticed the slope and helped someone show up in time. Maria collapses at home. Her husband calls emergency services. In the ambulance, AI-powered imaging and neurological assessment tools analyze her symptoms in real time. The system flags a high probability of stroke and identifies the likely clot location before they even reach the hospital. The ER is ready. The stroke team is assembled. Treatment begins minutes faster than traditional workflows allow. Maria walks out of the hospital weeks later with minimal neurological damage. In treating strokes, seconds matter. David lives in a rural area with limited access to specialists. He notices a strange skin lesion and uploads a photo through a secure AI dermatology platform. The AI flags it as high risk and sends it to a remote dermatologist and pathologist. A self-administered biopsy kit is mailed the same day. Results come back fast. Melanoma, early stage, completely treatable. Without AI, David might have waited months. With AI, his isolated location didn't decide his outcome. These stories aren't about technology for its own sake. They're about timing, attention, access, and support. AI works best in healthcare when it stays in its lane, augmenting human judgment, not replacing it. When it's transparent, when it's equitable, when it's designed to serve people, not systems. The future of healthcare isn't cold or robotic. It's more personal than ever. And it starts with stories like these, one patient at a time.